Test 1 2. Test 1 2. Test.
Okay, you're up. Can you adjust your camera so I can see?
Yep. Oh gosh.
There you go. Perfect.
Good.
Now look at me.
Good.
All right. There's Chris K. Glad you made it. Prepare to be disappointed.
Yes, we have a thing.
No problem, baby. Waiver, thank you for the 99 cents. Welcome to the channel. Oh, Amy, get the bee dry. Wait a minute, I don't think you can hear me. Amy, get the bee dry. That process was the greatest thing I ever paid for. It's expensive, but you'll never have a flooded basement ever again.
Amy, I just did what he said, and I'm glad I did.
Oh, you did? Yeah.
Literally, I did. Are you up in Western Kentucky?
Oh,
Is she up near Paducah? Maybe?
hell, I don't know.
Because they're getting a lot of rain. That's what I thought, Amy. Yeah, I was just up there last Friday night, Saturday morning. Sure hope you guys don't get washed away in the next 24 hours.
There's Amanda.
Yeah, old Mander.
Haha, McRibs. The robot hid your comment because you used the word intercourse. It's hilarious.
He shouldn't be having intercourse with a robot anyway.
All right. Enough of that. I have the red circle of doom.
Oh no. You poor thing. You still haven't switched out that computer, have you?
You come do it with me.
No,
I'll show
no.
you why.
I'm laughing because I know how busy you
No,
are.
no, it's not that.
I'm not being ugly. I just
No.
hate it.
I know. But it's
I hate
just
it.
it is such a pain in the ass.
Oh, it's got to be.
To switch, because it's just, I just don't have the heart.
There's
for it. I did it in the video studio, but I didn't have as much on that one.
And you got 4,000 cords coming out of the back of it.
Yeah.
Yeah.
All right, but I need to redo this whole place, so I've just got to get in here and
if you want it done wrong, I can do it.
Well, what I want to do is just empty it out and then put everything back in the way I want it. All right, you ready?
Yep.
I'm not.
You're close.
Be dry. It's a process, so they may call it something else, but it's, the letter B hyphen dry. I thought maybe we could do some live voicemails.
Yeah, sure.
That I have not pre-vetted.
Uh-oh.
Just see. It's like 6 of them from Stacy.
Well, at least they'll be good ones.
Yeah, they're always good.
Keeps me out of the doghouse for not doing my homework.
Yeah. Well.
At least I'm consistent.
Yep. Okay. Hang on, I'm going to send her a link to Be Dry. There you go. I don't know if it'll let me post a URL. Oh, yeah, I guess I can because I'm the man.
You are the man.
There you go, Amy. I did it in my... Listen, I bought this house. I was remodeling the basement, and it flooded every time it rained of any amount. And so the Be Dry people came out and said, oh, you don't need what we have. Just put in a gutter, outlet that goes away from the house.
Mm-hmm.
So we ran this thing underground so that when water came down, it would go out into the yard instead of, just right next to the house. We finished the basement.
Oh, no.
And then we had this huge rain, and it flooded. And the weird thing is the lady from Be Dry just happened to call saying, I guess because we had this deluge, and she said, I just wanted to see how everything was going. I said, well, I've been cussing you all night because I've been down there cleaning this up. So she was like, oh, shit. So they came out, and they did the whole thing for like half price.
Oh, my goodness gracious.
So they'll have to put in a sump pump, and
Yep.
then they take a device like a jackhammer, and they make a trench all the way around the periphery of your basement, and then it empties into the sump pump, and then the sump pump pumps it out. So you hear it running, and that's when you know, it would have flooded. It's really cool.
Yeah, I've got the same thing.
Have you had we had that a pretty heavy rain. Have you heard it working?
It was
bone dry.
Knock so far on
it
the wood.
works.
Yeah, it works. Yeah. Yep. So
because you can't stop it from coming in. So this just you can try to seal the walls, and it's going to come in anyway.
Still going to come in. Yeah.
This
you have
just
to go underneath the footers is what they did to mine.
Yeah.
They dug 12 inches under the footers.
Oh
for
wow!
mine and put put drain pipes. I had such a terrible problem. They put 12 inches under the footers
and then
drain pipes
with holes in
yep,
it.
Yep, yeah. And then so all that water goes into the, instead of going into my basement, goes into the sump pump. And it looks like a dadgum waterfall.
So you're letting the water come in.
Right.
Because you can't stop it,
right.
but you're channeling it into a, in an organized way so it doesn't flood your basement.
Yeah, they've got a really highfalutin plastic channel they put up against the wall, about a foot up the wall, and then all the way down past where the on the back side of the, or the inside of
but
where
it's the best money I ever spent.
No, agreed.
So,
yeah.
All right.
You ready? Let's do it. Rock and roll.
Oh, we got to start doing this at night because it's going to start getting hot in here. But doing it in the evening makes the most sense. But when we're done with the Sirius XM stuff, maybe we'll just do Friday night live streams every once in a while. All right. Oh, shit. Okay. All right. And here we go.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal Dr. Scott, the traditional Chinese medicine provider, who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listened to a medical show on the radio. If you have a question that you're embarrassed to take to your regular medical provider, if you just can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. How's everything going over there?
Doing pretty well.
Yeah, you still
pretty busy.
You need some tchotchkes to send out to Weird Medicine listeners who order crap from you.
We just sent some out the other day. We're still pretty good for now. Yes, which is crazy.
So just if you do,
yes, tell me.
Just tell him that you're a Weird Medicine listener, and he'll throw some stupid crap in there. It's garbage, but it's
good stuff.
It's fun.
It is fun.
And check me out on Normal World with Dave Landau. I've got a new one coming out on vaginal odors. And I have a really hacky joke at the end of it.
Oh, my.
Yes. But I was just doing assets, and I'll tell you what, the AI is really helpful for that. And I know the artists try, but I don't do AI art. I do it photorealistic. And I just, I want a picture of a doctor, smelling a slide with a woman, doing the whiff test. Mm-hmm. The whiff test being you take a sample of vaginal fluid and you put it on a slide, and then you drop a strong base like potassium hydroxide on it, which causes the cells to just lyse, to open up. Mm-hmm. And then you smell it. Mm-hmm. And if it smells like fish, it's a diagnostic for bacterial vaginosis. Mm-hmm. And it's called the whiff test. But I needed a picture of a doctor holding a slide up to his nose, smelling it and grimacing, and then the woman standing behind him with a horrified look on her face. And that's not easy to come by, so I just had the AI do it.
Oh, wow.
And it looks great.
Oh, how funny.
Yeah. So
where can you find that? Picture.
What do you mean?
Where can we find
I told Gemini to make it for me. I said, create an image of a doctor holding a glass slide under his nose with a disgusted, look on his face. He's furrowing his brow and wrinkling his nose, and the woman is standing next to him with a horrified look on her face, and it was perfect.
And it made it. Oh my God.
It goes, okay, here you go.
Oh, jeez. Isn't that cool? I love it. Love it, love it, love it.
So, so for that, I don't feel so bad. I don't want to take an artist's job away, but this is something that I would have just found a picture on the internet anyway.
Yep. Oh my gosh.
And we employ some artists over here. Troy Smith, just Google him, Troy Smith Art. He did the art for the Wet Brain card game that we're coming out with.
Okay.
And I've got to get Tacey the hell out of the house for a weekend so I can sit down and just do it, because I need about 8 hours of uninterrupted time, and that's impossible around here. So, I mean,
yes.
You're
going to have to go back on that retreat you went on and get some 8 hours.
Well, I could. They had really high-speed internet there, and you're right. I could do all my activities during the day and just work on weird medicine stuff, in the evening. Mm-hmm. That was the one time I did live streams consistently. Was when I was there. I did one almost every night.
Yep, I remember. How long has that been? It's a couple of years.
Yeah, we're getting ready to go on 2 years.
Yeah. Okay.
Yeah, we didn't wear masks and stuff. So was it? It was after. I mean, it was at the tail end of COVID.
It was the very tail end
right?
of COVID. Yeah,
it had to be.
Yeah.
All right. Okay. Well, anyway, so Normal World, youtube.com/@normalworld. It is. Dave has the best show on the internet as far as I'm concerned, and I don't know why it's not bigger than it is. It should be huge. The production values are great, and the guests that he has on are outstanding. When he has me on, it'll be the lowest viewer count of any show that they have, because nobody gives two shits about me. But, they have some pretty big comedians on there. Derek Richards is on there, and he's one of my favorite people. And he actually came to Knoxville and had got us tickets to come see him. And then we had some other damn thing. We had a conflict. We didn't get to go. So, but anyway, or you can go to Blaze TV, and just tell them that you signed up because of Normal World, and or tell them your old pal Dr. Steve sent you.
Right on.
All right. You want to just do a bunch of questions today? I don't have any topics or anything.
Yeah,
Tacey's not here.
Let's go for it.
All right. Okay. Let's see here.
Number one thing, don't take advice from some asshole on the radio.
All right. Very good. Sounds good. Now, this one just says voicemail, so I don't know what this is. So let me see.
Hey, Dr. Steve.
Okay.
Hey,
legit.
Tacey.
Hello.
Hey, Dr. Scott. How's everybody?
Good, man. How are you?
Up?
I've got a question about my hands. Some mornings I wake up and my hands are tingly.
Oh, okay.
And then as it progresses through the day, it's like a sore stiffness in my hand. Maybe it's arthritis. I'm getting close to 60 now. One time.
Well, the tingly, that's a nerve.
different, yeah.
That's a nerve.
Time I used DMSO, it was recommended by a friend, and immediately I tasted garlic. And I was wondering, is DMSO safe to use for arthritis? And should I be doing that? And is the tingly hand, could that be anything more than just poor sleeping position? Anyway, I'll hang up and listen.
Thank you, sir.
Yep.
So, a couple of things. Let's talk about the DMSO. It's dimethyl sulfoxide. It is an organic solvent. Mm-hmm. I remember first hearing about it in like the late 60s, early 70s for arthritis and stuff. It does readily permeate the skin, and when it does, you taste garlic. That's exactly right. Mm-hmm. And, there's a lot of people will use this stuff. They'll do a couple of things with it. They'll put soluble drugs in it, and it will drag the drugs through the skin.
Okay.
If they are also lipid soluble, they have to be lipid soluble. Well, to dissolve in the DMSO, they kind of have to be.
Gotcha.
And then they will. So it's a vehicle that you can use to introduce drugs into the bloodstream without injecting them,
okay.
Without having to use an injection. But so I have the safety data sheet. This is sort of the product safety sheet for people using it as a solvent. It says may cause respiratory irritation, drowsiness or dizziness, skin irritation, serious eye irritation, and it is also combustible. So let me see. If they get it in your eyes, obviously you wash it out. If inhaled, remove the person to fresh air. I'm just looking to see if there's anything long term on this safety sheet that says anything other than, here's toxicological information. Inhalation may cause drowsiness. Of course, all these organic solvents will do that. People inhaling glue, that's basically toluene, which is a benzene ring with a methyl group on it, I think, if I remember right. It's been a long time. But that's also an organic solvent, and people, are huffing glue, and it's one of these things. So most of those type of small molecular solvents will get you or alter your consciousness, but it's not good for you. Mm-hmm. Let me see. Mutagenic effects, no information available. Carcinogenity, whether is it carcinogenic, they don't know. There's no information available. Is there reproductive toxicity? They don't know. It's not been studied. Mm-hmm. So that's my concern about this stuff, is that they don't know. They just don't know. It's people have been using it for years. We haven't heard anything about it being naughty in that way, but still. But anyway, do you use any of these kind of organic solvents?
Nope.
Okay.
No. Willing to
FDA
try.
has approved DMSO as a prescription Medicaid for treatment of painful bladder syndrome, but they instill it directly into the bladder.
Right.
Let me see. I'm looking on WebMD just to see if there's anything. People have also used it to try to treat conditions like headache, rheumatoid arthritis, eye problems, scars, and scleroderma. That's a disease that causes scar tissue to form in the skin. But the American Cancer Society says there's no evidence to support the use of DMSO to treat cancer. That's for sure. Well, they haven't studied it, so there's no evidence. Doesn't mean it doesn't do anything, but why would it? It's just an organic solvent. Mm-hmm. Recent analysis of studies on the use of DMSO to relieve osteoarthritis pain found it was not significantly more effective than placebo. It's just you feel like it's doing something. Let me see. Okay. Most frequent side effects of using DMSO on the skin include stomach upset, skin irritation, and the strong odor of garlic.
Oh, there you go.
Some people can have severe allergic reactions, headaches, and itching and burning, and then do not take it by mouth. It is not designed to be taken internally, and I wouldn't, use it on my skin, to be honest with you.
Okay.
Yeah.
Yeah, I know they've used it for years and years for
yes
rheumatism.
Yep. And if people are breastfeeding, obviously don't use it.
Sure.
One thing is that there are DMSO can increase the effect of some medications, including blood thinners. So be very careful about that. If you're on blood thinner, I would not touch this stuff. Sedatives and steroids. So now the biggest concern is that when it gets on the skin, it causes anything on the skin to be absorbed if it's fat soluble. So if you've got something toxic on your skin for whatever reason, and then you put DMSO on there, it's going to introduce that into your bloodstream or make it more readily available. So, all right. So, whatever. Listen, you do what you want to do, but I'm not a big fan of DMSO anymore. I was back when it was popularized in the in the media, but then you go read the studies and the data just isn't there. Mm-hmm. And again, how do we know stuff?
Right.
You give people, 1,000 people DMSO for their arthritis and 1,000 people some other supplement. I mean, maybe you have to put some garlic oil in it so that they smell the garlic. and to make it a 1-to-1 comparison. And then you've got to subtract out the possibility that the garlic is doing something, right? Mm-hmm. So that could introduce a bias as well. But and then you have to see if there's a statistically significant difference between the two after you unblind the study. No, the doctor can't know, or the investigator can't know, and the patient can't know. Mm-hmm. And then there, at the very end, you decode the study, and you see, well, these people got DMSO, these people got placebo. Was there any difference? Well, how do you know if there's a difference? Well, you have to have a validated instrument that you can rely on for whatever endpoint you're looking for. Is it increased grip strength? Mm-hmm. That would be one.
Sure. That'd be
That's
easy
pretty objective.
Pretty easy measure, yep.
Or could it just be subjective pain scale on a scale of 1 to 10, divided up into tenths, and then look for a statistically significant difference. Mm-hmm. And so far, the studies where they've actually done that have not shown a statistically significant difference. So not a big fan. Now, let's go to the first part of his question. He's waking up with tingly hands. Mm-hmm. Now, I learned about this when I was about a year or two out of medical school or out of residency. I had a patient come in saying that they had tingling hands when they woke up in the morning and that they were numb. And I was just like, well, you're sleeping on your hands, because I do that sometimes, and I wake up and my arm is completely not useful. Right. And then when the feeling comes back, of course, you get hyperalgesia and allodynia, meaning that you can't even touch it. It sends pins and needles up into your brain until and that's just the nerve waking up. Yep. Well, it turned out that this person had carpal tunnel syndrome. Right. And I didn't recognize it. Right. And so I looked pretty stupid, but I never missed it again.
Right on.
So that's the thing. And carpal tunnel syndrome is a compression neuropathy, meaning that the nerve in your is being compressed, and it affects the thumb, the index finger, the middle finger, and half of the fourth finger usually. And now, if it's mostly the fourth and fifth finger, then that is cubital tunnel syndrome, which is a compression of the funny bone. Mm-hmm. Okay, so the funny bone feeds the fourth and fifth finger, the median nerve, where you have carpal tunnel syndrome, which is in the wrist, feeds the first, second, and third finger primarily. Mm-hmm. So it could be either one of those. I had cubital tunnel syndrome, where my pinky wouldn't work anymore when I was typing, and so they had to go in there and they actually take the funny bone.
An ulnar nerve deviation.
It's not there anymore. Right. It's not in that place. It's up here.
They move it. Yep.
They actually move it from under your that little knob on your elbow. Yep. And they move it up above there just to take the pressure off of it.
Do that a lot for pitchers. A lot of pitchers.
Oh, is that right? Yeah.
They'll do an ulnar nerve deviation.
Yeah.
Couple other things.
Yep.
Couple other things. Obviously, carpal tunnel syndrome would be something to check out since it's on both sides. Since it is on both sides, I also think about possibly cervical spine.
Is it in both sides?
I think he was saying
the whole hand. You mean when you say both hands? You mean both hands?
Yeah, I thought he said both of his hands. I mean, I may have misheard, but let's just talk about if it is both hands.
Yeah.
Then we think midline, which would be the neck and cervical spine, certainly a positional thing.
Yep.
He could have a stenosis like you've had in your lower back,
narrowing
of the spine.
Yep.
He could have a thoracic outlet syndrome that could give him a very similar,
we'll talk about what that is, because I've never seen a bilateral one.
I've seen them. Well, I hate to say I saw it yesterday. But you can get a compression of the nerves in the vascular system going out underneath your armpits,
right?
Underneath your first rib.
It's the first rib.
Yep, and you can get and the scalene muscles in your neck can pinch part of it off too. But anyway.
Right. So how would you diagnose that? There is a test that you can do at home for it.
Yeah, that's true. So what Dr. Steve's talking about is you can have someone have their arm down in a neutral position below their heart and check their pulse. And if you feel a nice, good, strong pulse, that's what you want. And then what you can do is you can move their hand over or up over their shoulder. And if they lose their pulse, that's a pretty good diagnostic sign that that's thoracic outlet syndrome. I'm not saying it's going to be, but that's a pretty good way to start the process. So
what I do is I have them put their arm down by their side with their elbow at right angles. And then you feel their pulse. And then you push down on the arm and have them turn their head the other way.
Okay.
And if it extinguishes, then that makes
pinches
the diagnosis.
The scalings. Yeah, that's a good. That's a great way to do it.
Yeah.
So that could be. And what about medicinal things? You think possible? I mean, it's possible if he's got it in both hands. If he gets in his feet, it could be some statin medications even.
So if it's there all the time.
Yeah.
But if he's saying he's waking up with it,
and if you take that medicine at bedtime.
Well, yeah, okay.
Possibly if it gets worse. But if it goes away during the day, then it's probably not that.
Yeah.
So at least there's, so at least you have some things to look into. Real quick though, can I add? If just what he can start doing, we call them prayer stretches.
Yep.
Which might help with the numbness some, especially first thing in the morning. Where you can just put the palms of your hands together right in front of your chest.
Yep.
And keep your palms right in front of your chest.
Yep.
And slowly pull down towards your heart or towards your tummy, and keep your hands right up against your chest wall.
Now, what is this supposed to do?
And that's going to stretch the fascia. It's going to stretch the fascia and that transverse ligament that goes.
You use these words. So
soft
fascia
tissue,
is just the tissue that sort of surrounds. It's the thin tissue that surrounds everything in the body.
Right. And it'll help stretch out the sheath that the nerve is inside of.
Yeah.
And it might help stretch out some of that tissue.
And this is for what? For carpal tunnel?
For carpal tunnel, right.
Oh, yeah.
So that might help some. So at least try that.
See, I played piano and I played it really poorly. And, I wasn't using good technique, and I got carpal tunnel from that. Once I finally got good technique, it went away. Now, one thing that you can do, if you want to see if you have carpal tunnel, there's a couple of tests that you can do. There's a Tunnel sign where you bend your wrist as far as you can in extension. So you bend it away from yourself. And then to expose your wrist. And so if you're holding your hand where the palm is up, then bend it so that the fingers are pointing as far down to the floor as you can, and then tap in the wrist. And if it recreates the pain, that's a positive Tunnel sign for carpal tunnel syndrome. And then you can just go to your primary care and say, hey, I need you to refer me to a neurosurgeon or whatever because I have a positive Tunnel sign, and they'll shit themselves. Okay.
I love it. I love it.
So I was thinking maybe we could use the pocket operator to differentiate between phone calls. Hang on.
Cool.
And we're back.
There you go.
All right. Let's see. I don't know what this is.
Hey, Dr. Steve.
Hey.
Hey, Casey.
Hey.
Hey, Dr. Scott.
It's the same guy. Oh, it's the same call.
What's up?
Okay, hang on.
Hey, Dr. Steve. This is Bill from Texas.
Hey, Bill.
Good to talk to you again. I hate to see you go, but I understand. I can't wait to see you go.
Well, okay. Let's clarify that again so that everybody knows. Yes, we are recording the final Weird Medicine episode. Let me see. I'm going to send them a message that says can't talk right now. We're recording the last SiriusXM regular show in Las Vegas at Hackamania, May 9th through the 11th. Get your tickets at hackamania.com. Use offer code WEIRD for 10% off. There's VIP tickets and there's regular tickets. It's a whole weekend of comedy and live podcasts and all this kind of stuff. And I went last year and helped set up and did, some stuff over there, and then did a couple of bits, and I did the pulling objects out of Rocco's ass.
Oh, my.
It was kind of magic trick thing. And but anyway, I was going to have like some of my celebrity friends do a video and so I just said to hell with it. Nobody gives a shit. So I'm just going to do a regular show, but we're going to take questions from the audience. And I've got cards where they can write stuff down. And, if they throw a 20 in there, of course, we'll answer their question first. Yeah. But and Lucy Tightbox is going to be my co-host. And then we'll chop it up and it will play on Sirius XM until the, our contract is up, which was 3 years ago. But anyway, now. What I want to do is more stuff like I do for Dave Landau with Normal World. I'd like to do some acting even. I've got, Pete Davidson called me one day and said, hey, we have a part that would be perfect for you. Can you be here on Wednesday? And it was like this was Monday. It's like, no, I can't. I can't. But I would like to be able to do more of that kind of stuff. I really enjoyed. I actually have an IMDb page now because of the acting, quote unquote, that I've done for Dave Landau. It's kind of fun. For the longest time, Tacey had one. Because of her work with Rockstar Games, where she did country voices for GTA 5.
Okay.
And it's like, okay, I've had this radio show for 20 years, but Tacey has an IMDb page. Well, now I have one.
Now you got one.
So, but I'd like to do more of that kind of stuff. We're going to do more documentary style things, and Friday night live streams will be a thing. And I want to do my gambling channel. I've got all kinds of ideas. There's this guy, Anton Petrov, that does, he's like, hello, wonderful person. And he does, every day he does a new science thing. I probably couldn't do every day until I retire, but I could do every week, do something on another, just a medical or a cool medical or science topic. And so that's what's going to happen. And maybe we'll do some live shows and we'll answer questions and stuff. Every time I go on somebody else's show, they always have people call in and just ask medical questions. I like doing that too. So we'll still be around, but just not on a regular basis. And the Patreon channel will still be very active, patreon.com/weirdmedicine, where we're going to I've got classic shows on there where you can't hear anymore, and then we're doing special projects, and they see everything that I do for Dave before anybody else does, even before the Normal World people do. So check that out, patreon.com/weirdmedicine. And if you want me to say fluid to your mama, cameo.com/weirdmedicine. It's dirt cheap. I do it just for the hell of it. And some people, if I do them while we're in the studio, I give them a tour of the studio. So there you go.
Cool.
I even played Happy Birthday for somebody on the piano. Anyway, all right. Okey-doke. Yep. Okay, so thank you. But thank you for the kind words.
And Dr. Scott, Cincinnati Reds suck still.
What's that? What did he say?
He's got a point. Cincinnati Reds still suck.
That what does?
The Cincinnati Reds.
Yeah, Who cares?
Cincinnati Reds suck still. My question is, I have a bowel movement.
Yes.
Majority of the time?
Good. I'm glad you do.
It sinks to the bottom of the bowl like it's supposed to.
Correct.
Why does some bowel movement float?
Yep.
Very astute medical question for you, Doctor.
Yeah, that's a good one. I'm not sure you're using the word astute correctly, but it is a good medical question. Scott, you want to take it? I know the answer to this.
They have some fat in it. That makes
Could be fat.
Float. Could be fat.
Could be fat. I'll give you a half of a bell.
Give thyself a bell.
Air, gas. Yeah, but it could be fat.
Yeah.
Fat but usually when you have fat in your stool, you have malabsorption.
Right.
You should not have fat in your stool. All the fat should be
absorbed,
broken down and dissolved.
Yep.
Unless you are taking something like Ali, that olestra, which was a non-digestible fat.
Right.
They were frying French fries in that shit.
Oh, my.
And people were eating it. And if you ate a whole bag of it, you just shit out, orange oil, basically. It just floated to the top.
Know that.
Oh, God.
My.
I had a friend, and she was a drug rep, and she was gorgeous, you know, and, you know, like as drug reps often are.
Yeah.
And she was going to a meeting, and she thought she had to, you know, pass flatus,
Yes.
and it was just voluminous orange oil that came shooting out of her ass, and she had to go back home and change clothes. So,
Oh my goodness gracious!
so that stuff was pretty rough. It's not, I don't think it's on the market anymore.
Yes,
You might still be able to buy the Ally or Ali or whatever it was, ALLI, which was a pill form of it.
Yep. Oh my goodness!
But so, yeah, if you have fat, it could make it rise, but you'll also see globules of fat. And if you see globules of fat and you're not taking an undigestible fat supplement, you may want to get that checked.
Right on.
I would, for a lot of people who have chronic diarrhea, I do a thing called stool for fat, which is they shit into a bucket for a day, and then they look in it. That's if you want to do quantitative fat, that you do it for 24 hours, and then they run it through a machine and they see how much fat is in there. And they look at it under the microscope, see if there are fat globules, and that is a sign of malabsorption. People whose pancreas isn't working right or their bile duct isn't working right.
Could have had maybe their gallbladder removed.
Well,
possibly.
maybe.
Yeah.
Yep. So,
So it's air or
so now air
yeah.
could be from a couple of things. It could be from what we call aerophagia. Some people eat so fast that they swallow air and they'll get bloating and pain, and then their stools will float because there's air in there. They'll also have voluminous flatus and stuff. But a really common way is to get air incorporated into the stool is for the bacteria to ferment something while it's in the turd form, and then creating air bubbles, sort of like baking bread. Right?
Yes.
When you bake bread,
it rises.
It rises
Okay,
because the
Got it.
yeast are making CO2 bubbles in there, and then when you bake the bread, it kind of fixes that.
Oh, wow.
And when I say fix it, set it in stone, sort of, in dough, and so you get those air bubbles in there. Now, that will be if you immersed that bread into a vat of dough, it's going to be less dense than the liquid dough, and it will rise to the top. And the same thing here, if you get enough gas production in your turd so that there's little pockets of gas and there's just enough in there, it will rise and be less dense than the surrounding water, and it'll float to the top. So that's where that's probably coming from.
Gotcha.
And, if you have really smelly, disgusting farts, you may have a bad, colonic flora.
Overgrowth of something.
Yeah, you may have an overgrowth of something bad.
Yeah.
And I recommend eating fermented foods for that, and not just yogurt. Yogurt is just lactobacillus. You want more than that.
Yep.
So, and if you ferment pickles, that's mostly lactobacillus. But you want some good yeast as well. So people make fun of me, but kombucha is a really good way to get more varied bacteria and beneficial yeast into your system. And if you don't like the taste of it, make smoothies out of it. My son and his fiance have gut issues, and the gut-brain axis is really important, and the gut can cause total body inflammation, which can cause all kinds of problems. Mel B, we were talking about this when she was here. She has autoimmune disorder, and she just had a widowmaker MI. So I want to put her on an anti-inflammatory diet. One of the things to do is to make a smoothie with anti-inflammatory type stuff in it. I would put kombucha in it. I would put kefir. Kefir is basically, it's like a liquid yogurt from the old country. And the people that eat that or drink that shit in the Ural Mountains live to be 120 years old.
Right.
And I would put, spinach in there, maybe every once in a while. I don't think every day is a little turmeric. And you can throw, and there's other things like that you can throw in there as well. And I think it would really help with that sort of stinky if you have farts that are chasing people out of the room, just change the flora in your gut.
Yeah, there's.
Okay.
Oh wow.
All right. Anything you have to add to that?
No, one other thing I love is I love sauerkraut. I love sauerkraut. You can
yes.
And a lot of people don't they say they don't like sauerkraut, but I'm going to tell you how to use it.
Okay.
If you'll get like just a normal sauerkraut, the good sauerkrauts you can buy in the grocery store. I will actually take those and mix them with spices and herbs and make toppings for my tacos. Oh, yeah. So I make a sauerkraut topping for tacos, and
that makes
way,
sense.
That way
sure,
you don't really know that it's sauerkraut, and it actually has got a wonderful kind of acidic.
Make
flavor.
sure it's fermented though,
Yes,
and that it has active cultures in it. Now you can make your own sauerkraut. Let me teach you guys how to make your own sauerkraut.
Is it going to stink him out of the house?
No, it's not bad.
Oh, is it not okay?
No,
it's not like kimchi, huh?
No, it's not. Although it is related to kimchi.
Related to kimchi, right?
So what you want to do is you get salt that does not have iodine in it.
Right. Like Himalayan salt or Celtic sea salt.
Or just even Morton salt that just is non-iodized.
Okay.
Right?
Gotcha.
And what you want is a 3% brine, basically. So I'm trying to find the actual recipe here because I hadn't planned on doing this. Well, you can Google it. But basically you cut the sauerkraut into however you want it. Do you want it long and stringy, or do you want little chopped up sauerkraut? And then you don't add any water to it. You don't have to. You're going to weigh it, and then you're going to add 3% salt to it, and you're going to mush it around with. You get a glove and just mush it in until it's well incorporated. Okay. Then you want to put it in a fermentation vessel where the liquid, because all of a sudden there's going to be all this water in there because cabbage is mostly
full of water. Oh, yeah.
And the salt will draw it out.
Yep.
And so you're going to have now a solution that's got 3% brine, and it's going to have the cabbage in it. And you want to put it in a fermentation vessel. You can buy one at I bought fermentation lids that go on mason jars, quart mason jars. And you pack it, and you got to make sure that the liquid is above the solid particles. And if you buy that kit that has the fermentation lids on it, it will also have a glass weight, and you just put that in there to hold the cabbage down. And after about 3 days, you'll start to notice that it's bubbling and getting cloudy in there. And what's happening is the brine prevents like botulism and other bacteria, but it promotes the growth of the natural lactobacillus that is living on the cabbage. And if you ever want to do this with pickles, with cucumbers, make sure that you buy pickling cucumbers. The ones that you buy that are shiny have wax on them, and they won't ferment. You have to buy the ones that are dull, or grow your own. And you want to throw a couple bay leaves in there too to keep it crisp. Anyway, and then you let it go, and when it starts to calm down and stops bubbling, it's pretty much ready. You can put it in a cool, dark place and let it sit there for a while. Now you got to make sure that you've got one of these lids, because it will explode if you just take a mason jar lid and close it down. There's some people will do that and burp it. I don't like that. I just want a lid that will release the carbon dioxide as it's produced. And that makes really good sauerkraut. It's not sour like some of the stuff that you buy.
Right on.
It's a little bit more mild, and it's good for you, you know. So,
yeah, it is good,
but it is mostly lactobacillus.
Cool.
So anyway, there you go.
There you go.
So yeah, let's change our gut flora. We need more fermented foods. We need a more varied diet. My kid eats chicken and fried, French fries. That's and he'll eat gluten-free pizza. And now if I'm out there with him, I can compel him to eat a salad, and he will eat a salad. He doesn't put any dressing on it or anything. But as far as him like going to the store and buying apples and shit, it'll never happen. Now, I think I was kind of like that. So as he gets older and starts paying attention to his diet, I think that he'll do better. When they were kids, I would make them smoothies, and you take a handful of spinach and throw it in there, and now they're eating spinach, but they can't taste it. There's no taste to it, but it's good for you. It's got iron and some minerals and vitamins
pizza
and stuff.
or chicken and French fries. Yeah.
So when we were on vacation this last time,
oh my gosh, how funny!
I made a smoothie for them every day.
Oh my gosh!
Now his fiance, she's all about it, so she can make him kind of follow suit. She's a good role model for him.
Good.
So anyway, all right. So there you go. Floaty stools.
Floaty stools.
Yeah. All right.
Hello, Dr. Steve.
Hello, my friend.
I have 2 questions.
Yep.
First question is, what happens when we're in outer space or like at the ISS
Yep.
for months on end
Yep.
where there's only 89% of the Earth's gravity?
Yeah.
How do our feet,
Well, it's less than that.
when they come back, are they black and purple and nasty looking because they're not getting the blood flow? Also, while you're up there, what happens to that blood-brain barrier? You figure a lot of the blood got to be going to the brain. A lot of our blood got to be going to the brain.
Yeah.
So what's happening is all the blood up against the brain and collecting like at a, I don't know.
I know what you're thinking. It actually, the volume of blood surrounding the brain, because he's right. If you're standing up straight, blood will rush out of your head. You'll still get blood flow to it because the circulatory system is a closed system. So as long as you're pumping, you'll get blood going up there. But most of the blood will pool in your legs, right? And then the veins pump it back up again into the rest of the body. When you're in zero gravity, it's like you're laying down flat all the time. And we say zero gravity, it's microgravity.
Okay.
And so they have some things to ameliorate that. They have treadmills and things like that. But what they don't have yet is a big centrifuge like they had in 2001 where you can just be in normal, quote-unquote, normal gravity. And now, when you're in a centrifuge like that, did you know you can't ride a bicycle in there even though it feels like gravity to you?
No.
The thing called a Coriolis effect. No. The fact that it's rotating, you won't be able to ride a bicycle in there. Because of the angular, there's angular momentum changes in there that prevent you from being able to ride a bicycle properly. You think that you can. You'll go, what the hell?
Really? Just fall off of it?
Yeah.
Oh, my gosh.
Yeah, it's kind of interesting. So, but anyway, so what they have now, though, is these treadmills, and they've got bungee cords to hold them down and all this kind of stuff, but it's a real compromise. And so they'll have decreased heart size because the heart doesn't have to beat as hard to get all the blood around where it goes. There will be fluid redistribution, as he said, with fluid swelling the face and upper body, relatively speaking, compared to when you're in gravity. And then they'll have orthostatic intolerance when they get back. And what that means is that orthostasis, standing up, and if you have really low blood pressure and you're laying down and you stand up and you feel faint, we'll call that orthostatic hypotension or low blood pressure when you're standing. So just think about it. When all this time they've been in microgravity, the blood just kind of goes, the
freely.
Heart pumps and it goes everywhere.
Yeah, freely.
Freely goes everywhere. Now they're in gravity and the body's like, what in the shit is going on here? And the brain, they'll feel faint when they stand up for a while.
Yeah.
They might have some sensory and coordination problems. They're getting hit by cosmic rays more often, so there can be changes in the retina and brain. But and the immune system will weaken as well while they're there, and that is still a little bit of a mystery, but it may have something to do with cortisol and growth hormone changes. And they'll have height increase because the spine will decompress. And that will go down.
I want to go there.
I know. Well,
maybe our back wouldn't hurt so bad.
Yeah, I bet it feels pretty good until they get back.
Yeah, until the gravity kicks in.
Now, the longer, and it is dose dependent, the longer you're there, the worse this stuff is.
Isn't that wild?
But the blood-brain barrier is not affected. So the amount of volume of blood going to the brain, I sound like I'm 16. The volume. Yeah. Well, Mr. Haney. I mean, Mr. Douglas. That was Mr. Haney. Just because you have more volume of blood surrounding the brain doesn't mean that the blood-brain barrier is being affected. So let's talk about what that is. Okay. That is a mechanism by which the central nervous system, which the evolution thinks is the most important organ that we have, is protected from some chemicals. So there are some chemicals, medications that you can give somebody that will not go into the circulatory system of the brain. They're prevented from going there. I'll give you a good example of that. There's a drug called naltrexone, which you can use to prevent opioids from having, it knocks things like Percocet or Lortab off of the receptors. And so it reverses, like if someone's overdosing, you give them naltrexone, or you give them naltrexone to prevent them from getting high because they're an addict, and they take it, nothing happens because the naltrexone is on the receptors and the opioids can't compete with it. Well, if you add a methyl group, which is just a carbon and 3 hydrogens, to that naltrexone, now it's called methyl naltrexone. It will not cross the blood-brain barrier. And now they can take their Lortab and their Percocet, and they'll still get the effects of it, even though there's methyl naltrexone in their system, because it cannot cross the blood-brain barrier. You go, well, why would you do that? Well, because there's other effects that opioids do, and one of those is constipation. And if you have someone that has opioid-induced constipation, you give them methyl naltrexone. They can still take their pain medicine. It still works for their pain, but now their bowel is no longer being affected by that because it competes with the opioid at the level of the bowel, and so now they can shit normally, So anyway, microgravity, to my knowledge, does not affect the blood-brain barrier, but that's a great question.
Great question, yep.
All right, let's see here. Okay.
Hi, Dr. Steve.
Hey, man.
Dr. Scott. How you doing?
Good. How are you?
Good. Thank you.
Hey, so my 58-year-old wife, the last few years, has been having a problem swallowing food. She'll have a piece of pork chop, for instance, and then get a drink because it's a dry piece of pork chop.
Yeah.
And the water doesn't go down; it comes right back.
We're
out.
not cooking it right if it's dry, but anyway.
And we get through it. So we had a swallow test done a couple of days ago, and that's led to a cardiologist that we're going to have to go see. And they're thinking circumflex aortic arch.
Wow.
Can you touch on that a little bit?
Sure.
On your show? Thanks. Bye.
Yeah. So this is an interesting one. It's very rare. I have never seen it. But people, and usually they diagnose this in children. It is a congenital thing. So people will present with complaints sometimes of difficulty swallowing. Sometimes they can't breathe. They'll have what they call inspiratory stridor, where they breathe like, that's inspiratory stridor. And when you do a chest X-ray, you see this sort of widening of the upper part of the middle chest under the sternum. And then you do a CT angiogram, which is a regular CT scan where you give them dye and you can see the blood vessels, and you'll see this sort of circumflex aortic arch thing. And it's really uncommon. Embryologically, it results from, I'll just throw some medical terms out there, regression of the left dorsal aorta between the left common carotid artery. In other words, it just doesn't form properly. And so you have this weird arch that can affect the esophagus and the, sometimes the trachea as well. And it can mimic an aneurysm in an adult, and so sometimes they'll freak out. And but it can be fixed, and so the fix is surgery, and it's not a small surgery. You ever seen anybody with this?
No, never. I mean, I've heard of it, but never seen it. I was thinking other things it could be besides a circumflex aortic.
Right. Well, sure, but
yeah.
I mean, we get the first thing you think of is just esophageal stricture.
Yep.
But it's a vascular ring, and there is the procedure. I'm looking at the procedure here, and the procedure is if you go to Google operative techniques circumflex aorta, and you can see some really cool pictures of it.
That's where I am right now.
Are you?
Sure am. Yeah, cool.
Yeah. So let me see let me see completed aortic uncrossing. The descending thoracic aorta has been brought anterior to the trachea and esophagus, and then anastomose. All that means is that it was just connected to the side of the ascending aorta. And then they have this ligamentum thing that's part of the band, and they ligate that. In other words, they cut it. Well, they ligate it. That means that they take suture material and they put it on either side, and then they cut it.
Yep.
And divide it. And then, this posterior compression that you get is completely relieved when you do that. And then the people feel better.
Yeah, then they shouldn't have the choking at that point.
Nope. And most people do extremely well with this, even though it is a big deal surgery. I mean, they're cracking open your chest and moving your aorta around. So you want to go somewhere where they've done this before. If they're saying, oh, hey, this is great, we've never done one of these, you get a second opinion from somebody who knows what they're doing. And so it's mostly going to be in university centers or big centers like Mayo or, Johns Hopkins or someplace like that where they've done a bunch of these. So just ask them, how many have you done? And what's your complication rate? And if as long as it's reasonable and they feel pretty confident that they can get it done, then you don't have to worry about it. All right? All right.
Hey, folks. Hope you all are doing good, including the fluid family.
Yes.
Anyway, I got a really sweet little friend of mine. We've been friends for a couple of years.
Oh, God.
Here we go.
There's Stacy with
anyway,
one of his sweet little friends.
Absolutely a weed head.
Okay.
And I came across a little study about something called CHS or cannabis hypermesia.
Hyperemesis.
But cannabis hypermesia syndrome.
It's cannabis hyperemesis syndrome. It's people who use chronic cannabis that instead of it working as an antiemetic, in other words, an anti-nausea medication, all of a sudden they start puking all the time.
Yep.
What do you know about that?
Well, I just told you what I know about it. So, yeah, it is a problem. And the only treatment for it is to quit smoking pot, unfortunately.
Yeah.
So, do you have anything on it?
Yeah, just you have to quit smoking the weed.
Yep.
Yeah.
Because it will not go away.
No.
I'm looking to see if there's you don't smoke pot, though, right?
I don't smoke in them.
Yeah. I see. You're being very cagey.
Yes,
okay.
I don't smoke.
No, I don't
smoke
pot.
anything.
Yeah. The only effective treatment for cannabis hyperemesis syndrome is abstinence.
Yep.
And it will lead to a gradual resolution of symptoms. It won't go away right away. Now, in the meantime, you can use things like ondansetron, which is sold as Zofran. There's another thing called metoclopramide, which I would only use. The brand name is Reglan. Use that for a short period of time.
Gotcha.
And then they use antipsychotics like haloperidol and things like that. And they also say hot showers can help relieve nausea and vomiting from it, but you just have to get off of it. And then the question is, can you reintroduce it into your system? I don't know.
Oh, maybe edibles, maybe.
Maybe, but in small amounts.
Yeah, I'm not telling you.
It may be the spike, too, that's part of the problem. Anyway, all right.
Feel better.
Thanks, everybody. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Right. Now, you got anything from the fluid family?
Dang lizard.
All right, dang. Oh, yeah. He's in Germany. All right, let's go through the stuff here. Okay. All right, before we get out of here, Dr. Scott, let's go through to the fluid family. If you'd like to join the fluid family, go to youtube.com/@weirdmedicine, and then click like and subscribe, but also click join. And you don't have to pay money if you don't want to. It's only 99 cents to join the channel, and sometimes I put members-only content on there. And I will be putting more members-only content on there when I start freeing up some time to do these things. But click accept gifted memberships. And when you click gifted memberships, then if someone gifts memberships in the chat room, then you might get one. It assigns them randomly. Mm-hmm. All right. So waiver, thank you for the 99-cent sticker. I would appreciate it.
Oh, yeah.
Very much, everything. Dang Lizard, €5. What's €5 in USD today?
Well, sounds like a lot, though.
Can you check it out?
I'll look.
All right. He says,
"Oh
like no, I missed the sauerkraut talk," and he actually spelled sauerkraut right because he is one. We'll have to listen to it later. Have a great show and all the best for Hackamania. Dang Lizard, I wish you could come to the United States in May 9th through the 11th for Hackamania.com. Use offer code WEIRD. Don't use Carl's stupid code. Use mine.
$5.48.
Oh, nice.
There you go.
All right. It offsets the Canadian money that we get from sometimes. Okay, McRib says, yesterday I went to my optometrist. I'm diabetic and have things under control. Hemoglobin A1C at 6.1.
Give thyself a bell.
Excellent. It's pretty good. Could be lower, but that's still pretty dang good. When I was in training, we thought anything under 8 was good, but they're really pushing it to like 5.7. Mm-hmm. My prescription hasn't been working, so I've been going without glasses. Said now farsighted instead of nearsighted. Isn't that something? So, as if you ever taken sugar and stirred it into a glass of water that's clear, clear glass, and you see those lines in there before it all dissolves, those are called Schlieren lines. And what that is those are zones of different density water, and different density water will refract light differently. Mm. So light slows down when it hits water and then speeds back up again when it, exits from the water. And that's why when you put a pencil in there, it'll look weird because it'll look like it's, broken, right?
Gotcha.
And these Schlieren lines are in there as well. That's basically what that is the light is being refracted differently, and you're seeing sort of the boundaries of the zones of sugar or salt that's being dissolved in the water before it's fully dissolved. Well, anyway, you can get those in your eye too. And so I've had people who had horrible diabetes, blood sugars at 300. They finally get their blood sugar under control. All of a sudden, their eyes are all blurry. And what it is the fluid in their eye is refracting light differently, and then it has to get used to it.
Oh, wow.
Yeah, pretty interesting. And it may change their prescription and all kinds of stuff. So, all right. Anything else?
No, sir. I believe that's about all
Chris
of
Mack
them.
says it's only $1, you bums. Join the fluid family. We don't get anything for it, so I do understand that. Chris Case has finally got an alert to join the live stream. Yes, click all notifications, and then you will get that notification. And you guys have already figured out, unlike Carl and Chad and all these other people, we don't really do a live stream. What we do is we record our show, and then we have sort of video going.
Yep.
So I'd like to do more of a video thing. So when we're doing video live streams, it'll be more coordinated and stuff. But right now we just have this static 2-shot. Tacy's not here today. Mm-hmm. I didn't bother even asking her because I know she didn't have a topic and she just didn't feel like doing it, I'm sure. So McRib says I have numbness in the mornings. And okay. He says now everyone is on the alpha lipoic acid bandwagon. I was there 20 years ago for numbness. I take alpha lipoic acid for my neuropathy as well. Mm-hmm. The first thing I noted when I started taking it was I could close my eyes in the shower and wash my hair without falling down.
Right on.
So, and I got down to about 40 words a minute on typing. I'm back up to about 100 now. I used to be 140. So, Chris Catterson says, I've got dumbness all day. How can I treat that? He's being funny, but there are things you can do for brain fog. And a lot of people have brain fog just because this world is conducive to brain fog. But there's post-COVID brain fog. There's post-influenza brain fog. Some medications cause it. I've had the best luck with lion's mane. And I get a drink called Odyssey Elixir or Odyssey Elixir. And it does have a little caffeine. It's like 85 milligrams of caffeine, but it's got lion's mane and cordyceps mushrooms in it. And to me, that's the best thing. I function higher on that than anything else. If you just don't want to take a big, 12-ounce sort of soda type drink, you can get Magic Mind. And if you use the code WATP, you help Carl out. It's magicmind.com and use code WATP.
Gotcha.
Okay, Dr. Scott, do you believe in the benefits of alpha lipoic acid? Well, who cares if he does? I do, because I know it works. All right. And he says don't take it on an empty stomach. Well, I take it at bedtime before I go to bed. Chris Catterson said load of shit. What's he talking about? What is he saying is a load of shit?
Probably the floating poo question.
Oh, okay. All right, very good. Let's see. Chris Mack says, I fasted from 9 p.m. Tuesday night until 9 a.m. this morning. It felt great. Can we do a segment on fasting, ketosis, and autophagy sometimes, please? Or autophagy, however you want to pronounce it. I don't think it's autophagy. That sounds weird. Yeah, absolutely. Chris Mack, just call in, 347-766-4323. That'll remind me. And Chris K says, I have inverse reactions with SSRIs. I have panic attacks instead of anxiety relief. Do you know why my brain is broken like that? It's not broken. Everybody's different. If we were all the same, we would only need one drug for everything.
Yep.
And also, if we were all the same, one virus could wipe all of us out. Yep. So that's why we have this natural variation. It's very good that we have that. And you just have to know that that's correct. Now, I wonder if the SNRIs would do the same thing. Duloxetine, venlafaxine, those are two SNRIs. They're serotonin, norepinephrine reuptake inhibitors. As a matter of fact, the old school antidepressants like amitriptyline, nortriptyline, and trazodone are all SNRIs as well. So they made a big deal when these things came out. Oh, SNRI, it's new. It's not. That's what the original ones were. Wow. The innovation was getting rid of the norepinephrine and doing the SSRIs because they're more specific. But for a lot of people, the SNRIs still work better. I hardly ever prescribe an SSRI anymore because, I deal with cancer pain, and the SSRIs are worthless for that.
Yep.
So, okay. All right. And Chris Mack, I used to take a shot of liposomal alpha lipoic acid every morning. I think it had a megadose of vitamin C in it as well. Okay, well, whatever. You'll just piss it out if it doesn't irritate your stomach to hell. That's the problem. When I took a lot of vitamin C, I just had heartburn all the time.
Give me diarrhea.
And then Chris K said Buspar worked for me. That's buspirone, but gave me tics. When I tried to take that stuff for anxiety, I got this serotonin rush, and I had to just sit there like I was, moving at 90 miles an hour. My body was like I was accelerating, and it would last for about 30 minutes. It made it very difficult to work, so that stuff didn't work for me. But it does work for other people. It's like magic. So, all right. Okie doke. Well, let's get out of here, Dr. Scott. You got anything else?
No, sir. I was going to say, let's wrap it. Oh, my God, Steve, look at this.
What do you got?
That's my freaking wallet I thought I lost 2 months ago.
Are you shitting me?
Yay! It's the best day ever.
Oh, yay.
Yeah.
Okay.
Give myself a bell.
Yay.
What's it got in it?
Oh, it's got like 50. Here, I'll share it
you
with you.
mother of...
$100. $120.
I would not have stolen it, but I'm glad.
No, I know you wouldn't have. No, thank you. I thought it just left it on top of my truck and drove off.
Oh my God!
But at the gas station,
did you have to get rid of your credit cards?
Yeah, I got everything new. Everything new.
Oh.
No, it's okay though. No, I'm just glad I found it.
Okay.
Yeah. Hey, we got $100. We can buy lunch.
No, you go do your thing with that. I'm sorry that it got stuck here.
No, that's awesome.
All right. You want to play some music?
Let's play one.
All right. We're going to play music.
If you'll turn on the air conditioner.
Oh, yeah, of course.
Hey, thanks, guys. Hey, you got to do the intro.
All right. Yeah, I got to get out of here. So what we do, if you want to join the Fluid family, we horrify people with terrible musical renditions of beloved songs that ruin them for you forever after the show is over. So thanks goes to Dr. Scott, everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, but on demand and other times at Jim McClure and Lewis Johnson's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thanks, guys.
All right, let me save this real quick before we save as. Don't save it and save over the template like I did last time. Okay. Let's see. So this is 0405.
So this is 0405, yep.
And it's for broadcast.
0412.
I can add 7 to 5. Oh, hey, have you ever done serial sevens? You know about serial sevens, right?
Mm-hmm.
So if you're ever in the loony bin, they're going to ask you to do serial sevens just to see how your cognition is. I'm going to give you a trick. And most people could figure this out if they thought about it long enough. But so take 100 and subtract 7.
93.
Okay, now subtract 7 from that.
Oh, God. 84.
Nope. So let me tell you what to do. You add 3 to the number that you had and subtract 10. Okay.
So 86.
It's 86, and then it'll be 79.
Oh.
And then the next one, of course, 79 minus 7 is going to be 72.
Yep.
So add 3 to that, it'd be 65. And so that's a trick so that you can blast through these damn serial sevens and it makes you look like a genius.
Interesting.
Yeah.
I will remember that. So that's
Little
pretty
trick.
Cool. That's cool.
All right.
That is cool. I remember that. Add 3.
All right.
Who?
What are we going to play?
Let's go old school.
All right.
Let's do a little bit.
Do some old school rap. A rip, rap, ribby, and a rip, rap,
Oh,
ribbity-doo.
no, hell no. That's what we need PA John for. How about a little make me down a pallet on your floor in D?
Okay.
I mean, in G, I mean.
Okay.
Make me down a pallet on your floor. Make me down a pallet on your floor.
What the hell? Oh, leg cramp. God, why does it do it every time? It's something about this chair. I gotta get a new chair.
Yeah, I think it's probably because you're mashing that sciatic nerve.
No, I don't.
Mashing your femoral.
You think that's it?
Maybe just it's like people
It's
get
just,
on
I think
church
it's just
pews.
the position that I'm in.
People get it like when they sit on church pews.
Oh yeah,
toilet bowl sciatica.
yeah, but it's not sciatica though. It's a
No,
literal
it's
Charlie
vascular.
horse.
Always a cramp.
All right. All right.
So if you look up Make Me Down a Pallet on Your Floor live, and that's by Doc Watson.
Okay.
We'll do it in
Under
G.
in Ultimate Guitar.
Yep, in G.
All right.
Come to Daddy.
What'd you think of doing that Roy Orbison song? You're gonna have to take it down an octave and do it with your country voice instead of trying to do Roy Orbison.
Right.
And I think we need to do that with Karma Police too. We need to just do it with the mandolin and the bass, and you run it down an octave.
Okay.
And because I like the idea of doing the sort of mountain versions of these songs, you know.
Mm-hmm.
But the candy-colored clown they call the Sandman. Sneaks into my room every night. Roy Orbison was just the greatest. Now, are you going to use the other mic?
Is it?
I can turn it on.
Yeah, if you want to turn it on, please. Let's see here.
You're going to have to turn it on.
Turn it on, baby. There you go. Oh, she's hot now, buddy.
Yep.
Take me down a pallet on your floor. Make me down a pallet on your floor.
You talking about Mississippi John Hurt?
Honey, no, I'm Doc Watson.
Okay.
Make it down, make it soft and low.
Now that's really important that you get that progression right.
Oh yeah.
Now this is a pro version.
Is it? It's a pro version.
The Doc Watson version is a pro version.
I've got a version. One says 18.
Okay. Let me look.
Make me down a pallet on the floor live.
Yeah, I got it. But let me see if I can just get the chords then.
Yeah.
How do I do that?
You mean to email it to you?
I should be able to find it.
Make me down a pallet on your floor. Honey, make it down. Make it soft and low.
You got one that says 18?
Yeah.
Okay.
I'm going to email it to you right now.
Okay, I got Doc Watson. God, he's got a bunch of them.
Yeah, he's got a million of them.
Oh, I got it.
I was saying,
I got it.
Cyberspace here too.
Yeah. And there's no break or anything, so it's all the same.
Yeah, once you kind of get the
And you want to do it in G, you say?
Yeah, so
because it's in F.
Yeah, I just don't want to make.
Okay,
I just. Let's go through a little bit.
Okay, I got to transpose it up one. Okay.
So what I just that G, the honey, the D to the F sharp 7 G. I just went G7, and then
You don't want to do the F sharp 7. I
do the D F sharp 7.
Yeah, and then the G7. Yeah,
and then G7, and then back to the D. Me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Somewhere where my good gal, she won't go. I'm going up the country through that sleet and snow. I'm going up the country through that sleet and snow. Sonny, I'm going up that country through that sleet and snow. Ain't no telling just how far I might go. I get my breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. I get breakfast here and my dinner in Tennessee. I told you I was coming, so you better look for me. Make me down a pallet on your floor. Make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go. down on your pretty bed. You know I can't lay down on your pretty bed. Now, honey, I can't lay down across your pretty bed, 'cause my good woman, she might shoot and kill me dead. Don't let your good gal catch you here. Hey, don't you let my good gal catch you here. If you do, she might shoot you, cut and stomp you too. There ain't no telling what that crazy woman might do. Well, make me down a pallet on your floor. Well, make me down a pallet on your floor. Oh, honey, won't you make it down, make it soft and low. Somewhere with my good gal, she won't know. The way I've been sleeping, back and shoulders tired. The way I've been sleeping, my back and shoulders tired. Oh. Honey, well, the way I've been sleeping, my back and shoulders tired. I think I'll try sleeping on my side. So make me down a pallet on your floor. Well, make me down a pallet on your floor. Well, honey, won't you make it down, make it soft and low. Somewhere with my good gal, she won't go. Well, one more time. Well, honey, honey, make it down, make it soft and low. Somewhere with my good gal, she won't know. I missed the damn G. Big dummy. Oh, I love that. Don't you love it, Swing?
Yeah, it's good.
Oh, my God, what a great classic song.
I could probably practice that and do it a little bit, a lot better, but...
I could too, but you know, it's such a beautiful walking bass. Man, it's just perfect. And I just hadn't played that in so long. That's fun, though.
Yeah, we should get a clean version of that to put up on the
yeah, I think we could do that.
You want to do it?
Yeah, I think
we'll do it now?
Yeah, let's do it. We'll do one more and we'll call it a day. All right. Let me get my scroll at the right speed, too. So I don't have to stop in the middle.
Let's see. Hang on.
Is this your mix?
Yep. All right. All right. You ready?
Yep. Oh, shoot. Oh, what did I just do? I just somehow emptied all my... All right, yeah, no, I'm good. All right, let's hear it. Okay. Let's do it. You ready? 1, 2. 1, 2, 3, 4. Make me down a pallet on your floor. Make me down a pallet on your floor. Oh, honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go. I'm going up the country through that sleet and snow. I'm going up the country through that sleet and snow. I'm going up that country through the sleet and snow. There ain't no telling just how far I might go. I get my breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. I told you I was coming, so you better look for me. Make me down a pallet on your floor. Well, make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Then my good gal, she won't hardly know. You know I can't lay down on your pretty bed. You know I can't lay down on your pretty bed. Now, honey, you know I can't lay down across that pretty bed. A good woman, she might shoot and kill me dead. You know my good gal, she can't catch me here. You know my good gal, she can't catch me here. Well, if she does, she might shoot and cut and stomp you too. There ain't no telling what that gal, she might do. Oh, make me down a pallet on your floor. Well, make me down a pallet on your floor. Well, honey, don't you make it down, make it soft and low. Then my good gal, she won't hardly know. Well, the way I've been sleeping, my back and shoulders tired. Well, the way I've been sleeping, my back and shoulders tired. Well, the way I've been sleeping lately, my back and shoulders tired. I think that I'll try sleeping on my side. So make me down a pallet on your floor. Well, make me down a pallet on your floor. Well, honey, won't you make it down, make it soft and low. Then my good gal, she won't hardly know. One more time. Honey, make it down, make it soft and low. Then my good gal, she won't hardly know. There you go.
I messed up.
There you go. Not too bad.
I gotta practice that.
All right, that's good stuff.
You got nothing else you want to play?
No, I don't think so.
All right. All right.
I'm good. That's good though. I just don't know how. I can't hardly stand the fact I found my wallet after. Hey, the one pun's in.
Hey, one pun.
Hey, one pun.
What up, one pun?
I sure hope you guys have a good weekend. We gonna try this next Saturday?
Yeah.
Good.
Oh no.
Are you out?
Yeah, we might have to do Wednesday night.
Okay.
Hey, one fun. How can you spot a nosy pepper It got jalapeno business. Yeah. Do you get it?
That's a good one.
I'm addicted to brain brake fluid, don't you know? But it's okay, because I can stop anytime I want to. You get it? Do you get it?
That is terrible.
What do you call an alligator that's wearing a vest because he's highfalutin? That's an investigator, don't you know? Don't you know that? That's a good one. Well, there you go.
There you go.
What did one eye say to the other? Just between you and me, something smells. Because, you know, with the nose, it's right there and you can smell with it.
I really hope this is being recorded.
What do you say to a llama that loves picnics? Alpaca lunch. Oh, Dad burned you. Coleslaw. Well, all right. Let me do. Here's a physics one for you. You'll like this one, Dr. Scott. A photon checks into a hotel. The front desk asks if it's got any luggage. It says, "No, I'm traveling light." Because, you know, photons it's a wave particle duality with it's light. All right,
let's get out of here.
Okay, one more.
No.
Now, Dr. Scott, I can't stand them Russian dolls, you know. They're so full of themselves. Oh, there you go. Because, you know, if you open it up, there's another one in there. Cletus always has to explain the joke.
Goodbye, folks. Bye.
Did you hear about them new corduroy pillowcases, one pun? They're really making headlines. Because, you know, when you lay on it, it makes them lines. All right. Thanks, everybody. You're a bunch of good ones, I'll tell you that. All right. We appreciate you. I hope the Patreon people listen this long. They'll get some good old country humor. All right.